It is Tech Tuesday. VMA is a new technology that helps facilitate, diagnose, and the treatment of lower back pain. With us this morning is Dr. Neville Aline, and he is with Tri-City Medical Center. Good morning to you, sir.
Good morning, David.
You've been with Tri-City a long time now.
I have, 23 years.
23 years, and in all that time, you have come up with something that probably excites you as much as anything you've ever done, right?
It's groundbreaking. Yeah. It's a wonderful revolutionary technology looking at the way to functionally assess the spine and motion in the spine. Prior to this, it was just static films.
That's what you mean. When you say functionally, it actually takes the spine in action.
Absolutely. So you're seeing what's happening when the spine is moving, and you're not looking at other motion like with the hip or the neck or the shoulder. You're isolating that motion in the spine, knowing what's happening at each segment of the lumbar vertebra.
All right, you've got some video here. Tell us what's going on here.
Sure. This is a patient that's in that VMA, the vertebral motion analysis, and we're looking at the motion in both lateral and flexion. And here's an x-ray in the lateral position, and you're actually seeing how the vertebra moves in live. And so at this point, we are now assessing each level and assessing how much movement is occurring at each level.
Now, why is this more important, more thorough than the usual x-rays and different things that you've had?
If a person has pain, they limit their amount of movement because they're in spasm. If a person has problems with their hips, they may not be able to move as much. This isolates the spine, and you're looking at the dynamic movement at that level, and we're getting an accurate measurement of how much that movement is. Currently, right now, the industry and insurance companies are demanding this type of information because fusions in the future, they're going to need to have some documentation of what instability is before they go on to a fusion.
Now, you've been talking about lower back pain. Is that what this concentrates on, is the lower back pain, which is the main ingredient of back pain, right?
That is correct.
Yeah.
It's 80% of the injuries at some point in people's lives end up necessitating them seeing a physician. And in the work comp population, back injuries are only second to the common cold for the most common reason for absenteeism in the workforce.
I believe that. Everybody goes through it at some point in their lives, it seems like.
That's exactly right.
So you have a little show and tell here for us. What are we looking at?
This is a model of the lumbar spine. This is a fusion in which rods and screws are placed to stabilize the spine. And when we do that, we add bone around this to allow the fusion to knit. That knitting process takes a few months and sometimes finally matures after a year. But some patients still have back pain. You get a plain x-ray, and the x-ray still shows that there is a solid mass there, and they say there's nothing wrong. And you can't see it on a plain x-ray until now. With VMA, this is a groundbreaking technology being used at Tri-City Medical Center to basically identify this abnormal motion that can be sometimes visually documented on these scans.
And from a patient's point of view, there's nothing more frustrating than having that pain and go to a doctor and they can't figure out what it is.
David, you're on the money. And that's exactly what happens. A person went through a big operation. The doctor says the fusion looks solid on plain x-ray. And now, with this technology, we have actually seen where the fusion is actually unstable. And here is a model showing some abnormal motion in the spine. And you can see that when a person bends, that abnormal motion can be translated and result in pain. So even though they've been fused, now we have abnormal motion.
And Tri-City is only 1 in 7 places in the country. Why is that? Do you believe it'll become more widespread in the future? Or?
I do. I believe this is a groundbreaking technology. Tri-City is also doing robotic guidance for the placement of pedicle screws, which is one of 8 in the United States. And I believe that at this point, this is the way of the future. And again, insurance companies are going to demand this. The amount of radiation involved with this is about 30% less than routine x-rays that are being taken now.
Doctor, thank you very much.
My pleasure.
We appreciate it. And don't forget to check out the Tech Report link here at KUSI.com. You can find the latest in local tech news and video links to our past tech reports. Check it out, KUSI.com.